Hello, everyone. Welcome into another episode of the East Alabama Works video podcast. I'm Carl Brady, the Workforce Program Manager for East Alabama Works. We represent Region 2 of the Alabama Workforce Council, the 7 counties of East Alabama. And we are doing this video podcast to give you information during the COVID-19 crisis, things that are important to your community, to the business and industries, and to the community in general that we serve here in East Alabama. And we're happy to have with us today as our special guest, the director of the Calhoun County Emergency Management Agency, Michael Barton. Michael, welcome into our podcast. Thanks for joining us.
Yep. Thanks, Carl. Appreciate you having us today, and looking forward to it.
Well, let's just get started off a little bit with just a general overview, if you will, of this pandemic and the last couple of months that we've had here in Calhoun County and throughout the country and throughout the world. How this hit with you guys, your initial response, and how this thing is continuing to affect the EMA.
That's right. Well, as you know, in Calhoun County, we've been operational since February. Actually, February the 22nd, when the U.S. Health and Human Services made an announcement that they were bringing cruise ship passengers that had tested positive for COVID to Calhoun County to house them out at McClellan at the Center for Domestic Preparedness. That was on a Saturday afternoon. I remember it well. At 12:33, HHS sent out a press release to the media stating that that was what was going to happen. Unfortunately, they had failed to coordinate and communicate at all with the local government, and which therefore that caused many problems. They didn't communicate and coordinate with the local healthcare facilities, and so we had to spin up our operations immediately to make preparations for that. And through the political process, as you know, they ended up calling that operation off. But it really helped to engage our community, both the citizens as well as the healthcare community and the first responder community and the local governments. And from that point on, we have been wide open, preparing for, and then at the end of March, beginning to respond to positive COVID cases throughout the county.
So that actually served as a little bit of an advance notice for the community that something was going on that was much bigger than we initially thought it was going to be, and gave you an opportunity to get the county prepared for what was eventually the response.
It did. We had already started in early January in conjunction with Jacksonville State University looking at pandemic planning. We had hosted a couple of countywide conference calls with our elected officials, our public safety officials, our healthcare officials, just to broach the topic and say, hey, we're looking at this over in China. We know it's starting to travel around the world. Are we prepared? And what measures do we need to take? So we worked on some of that, just general education initiatives, as well as some information on our website in the month of January and in the first part of February. And then when HHS made their announcement, it put us into full gear, in preparing the county. On the 23rd, which was that Sunday afternoon, the Calhoun County Infectious Disease Task Force was formed, and which was the preparedness organization that made sure all the boxes were checked, that everybody was fully engaged. We had great participation among all the healthcare and the public safety professionals of this county to participate in that process. And that really set us up to be able to respond as effectively as we have to the threat of COVID in Calhoun County.
What is your assessment of how we have weathered the storm in Calhoun County and surrounding areas?
So in Calhoun County specifically, so far we've weathered that very well. Now, before I say any further on that, I want to be clear that could change today or that could change tomorrow. It's important for the citizens. It's important for our public safety and public health partners to continue to be diligent in their efforts for their protective measures that we've put in place and to take this threat very seriously. But we've weathered the storm very well. To date, we've had over 130 confirmed cases. And while one death is too many, only 3 confirmed deaths so far from this in Calhoun County. And when you look at statewide at some of the other counties, they've been very, very worse off in that respect. And so, we continue to see things here trend in a very positive direction. Over the last 7 days, that's kind of how we're tracking it now in 7 and 14-day periods. we've seen all indicators trend downward. With less COVID cases confirmed on a daily basis, less hospitalizations, and thankfully, we've not had any deaths over the last month. And so Calhoun County, the people of Calhoun County, the public safety, the public health, as well as the local government officials have really responded to the call for preparedness, taken it serious, and our results now, several months into this show, that the benefits have been good for the citizens of Calhoun County.
At this point in time, we're a couple of months into this. Businesses have been closed for a while. A lot of offices, our office, our East Alabama Works office, actually closed down. We've all been working from home since March the 16th, and don't look to be going back into our office anytime soon. But as we are getting to a point where the state health officer and the governor are allowing businesses to reopen, what are some of the best practices that you're finding and that you guys are putting out there for businesses and the public to follow as we try to get things going again?
That's right. So, as I said before, it's important to continue to take this serious as we reopen. We want to do it safely. So we have formed in Calhoun County to follow up from the task force, and then we have the unified command that continues to operate during the response phase. But looking ahead to that safe reopening that we're encountering now and that short-term recovery, we set up an advisory council to look at best practices in that area. We've got all these best practices on our website, calhounema.org, and under the safe reopening tab, there's a lot of information there. But what is probably the best guidepost for folks as they begin to reopen is our Pandemic Ready program. And this is a simple one-page checklist that takes you through the things to help prepare your people and your places for a pandemic. And you may say, well, we've already been through the pandemic. Well, we want to continue to make sure we reopen safely and recover well from what's happened so far. And the health experts tell us there's a good possibility that we could encounter a second surge in cases. And we're seeing this in some counties around the state. They are just now entering their first surge, their first true surge. And so this is something that we need to take very serious. So specific resources or the Pandemic Ready program, it walks you through simple things. It's a common sense approach to being prepared for this. But we look at things such as that 6-foot distance between people, so that whether it's the people that work there, the employees that from their workstations, that they can maintain a safe 6-foot distance, or if it's the customers or the clients that are served by that organization, that they're able to maintain a safe distance from each other while they're there. In regard to our places of worship, we have a section on there that really talks about how churches and some of the unique challenges that churches face can look at some best practices that are being employed not only in this county but in other places. We've tried to not necessarily reinvent the wheel, but make sure that folks know where to get the information at. So that takes care of businesses, it takes care of churches, it takes care of local governments can follow a lot of those same practices as they reopen and begin to continue providing those essential services to our constituents. As well as families. There are some things in there that families can consider for homes or for large gatherings, at birthday parties or at whatever the occasion may be. They don't want to completely stop that. We've paused life for long enough. We need to be able to figure out how to move forward. It's not plausible to think that we can completely stop the spread of COVID. The purpose in closing everything down and having temporary shutdowns across the state and across the nation was to simply to level out that curve and to allow our hospital capacity, our first responder capacity, all those essential services to be ready to take on that surge of COVID cases. And so at least locally in Calhoun County, we've successfully done that. So now as people go back to life, they just need to remember these precautions, reuse these resources, and to make sure that they're doing it as safely as possible. Another thing for each of us to think about is the wearing of masks. When we wear a mask out in public, it's really not to protect ourselves, but it's protect others. And our local health officials tell us that up to 10% of the people being tested right now for COVID in our county are positive. 10% are asymptomatic. They're going around asymptomatically, but are positive. They don't realize that they're there. And so it's important for each of us to wear a face covering. to be able to protect others around us from that. So to think about those things, to protect ourselves, protect other people. Of course, things we preached early on, hand washing, right? Make sure that if you feel sick at all, that you stay away from other people. It's not worth risking that to others. And you may say, well, the majority of the population, may get it, but they're not that adversely affected by it. And that was some of the early information that was available. What we have seen is some of that holds true, but also there have been young people that have been very harshly affected by COVID, both in their 20s and 30s. But now we're seeing a rise of this symptom called, or this disease called the Kawasaki disease that affects young kids as well. Once they've been affected by the COVID disease, then they can have these problems that occur well after. So it affects everybody. We do have to make sure that we protect those most vulnerable among us, which are the older population, those with pre-existing health issues. So we have to be sensitive to that and make sure that we are wearing face coverings, we're doing face washing, we're keeping that 6 foot distance among all of us when at all possible. And that we're cognizant that this is still a threat. It's not going away. And the health experts tell us it's not going to go away for a long time. We may still be dealing with this at some level in the year 2022.
Is this something, though, that we will eventually just kind of learn to live with it? It's not going to be something that's going to be eradicated. We're going to wake up one morning and they're going to say COVID-19 is gone. This is some form or fashion will more than likely always be with us, but we'll learn to integrate it into our daily routine.
So we'll learn to integrate it, but also medicine will continue to develop. The scientists are actively working on vaccines that would be effective for this, just like what we have for a lot of other diseases that are here. They've been here for a long time. We've learned to adapt with it, and we've also had good medicine and good best practices in the medical community to be able to prevent a lot of that from it. And also the medical experts have talked about this herd immunity concept that when a number of us become exposed at some level to it and survive that we are then more immune as a community, more immune as a people to that particular disease. So it's a combination of things. Right now, we're still in the very early stages of it. And so those preparedness efforts and those mitigation efforts that we talked about, the distancing, the hand washing, all those things, the face coverings, those are mitigation activities that we need to make sure we're diligent in while we're waiting for the scientific community to be able to develop those vaccines that really will be a game changer, I think, just like it has for a number of other infectious disease, across the years, for us to be able to then resume life to that, which will be a new normal, but more normal for what we were used to in the past.
You mentioned our elderly population, our most vulnerable people. As we start the opening up process, people begin moving around more freely. Is it still advisable for our elderly folks and for the most vulnerable to limit their movements until we get to a better place?
Well, it definitely is. Even though we're not seeing a large amount of community spread right now in Calhoun County, we know it really only takes one, and then making contact with another one, and very quickly, just like a wildfire, quickly grows out of control. So can COVID. And so it's essential for those folks who are our older population. Healthcare professionals tell us really that 65 and up age group, as well as those who have pre-existing health problems with heart disease, lung disease, those kinds of things, that they need to continue to take extreme precautions and make sure that they limit their exposure to people. To other people outside the home, that they look at, utilizing technology to do a lot of the things that they were used to doing before, that they continue to maybe utilize online ordering for certain things that they would normally go to the store for, when attending places of worship. While, that's very important to all of us, we can also now use technology to interact with congregations and to attend worship services. And so it's important for us to continue to use those resources, even though we started reopening, especially for those people that are most vulnerable. And so technology is our friend. It can be, as long as it works well. And so people should go ahead and, if they haven't already, figure out how they can employ that, into their daily life, and to make that a part of it to help protect themselves, from being able to help protect themselves from being exposed to the disease, potentially contracting it, and keep them healthier, as they move forward in the future.
Mhm. Let's talk about education a little bit. A lot of our area schools are now able to move forward with graduation programs. What kind of involvement have you guys had in advising our local school boards and our local schools on best practices for graduation over the next couple of weeks?
So many of our local school systems have been involved with the task force from the very beginning. They have been plugged in with the unified command at some level, and now through the advisory council, they continue to be very actively involved. I've recently spoken both personally as well as in a conference call meeting setting with all 5 of the superintendents of the schools within Calhoun County. So the superintendents are very engaged, their staff are very engaged. We do have contact with the State Department of Education through some of our task force members that are in education, and we know that the State Department of Education is in the process of rolling out some guidelines for the safe reopening of schools in the fall. But for the immediate times, we've been trying to come alongside our school systems and advise them on these practices of social distancing, 6 foot apart, limiting contact with people as much as possible during graduation ceremonies. And so what they've had to do is they've had to have multiple, some of the schools are having to have multiple graduation services to be able to accommodate all the people that would normally come to graduation, and to maintain that 6 foot social distance. To make sure that hand sanitizer is available, to encourage or require face coverings, and to provide those and have those available, at these different ceremonies. So we continue to be very closely engaged and supportive of our local education agencies as they try to finish up the school year now with graduation, and as we look ahead over the summer to how they'll safely reopen and what those best practices may be.
How much of a challenge has it been for your EMA and other EMAs across the state to juggle multiple kinds of responses? So, in the middle of the COVID-19 response, we're still we've got tornado season getting ready to start here in the state of Alabama. We have severe weather every spring. We've got hurricane season coming up, and other types of disasters and things that who knows what may happen in the middle of this concentrated effort on COVID-19. How are you guys planning ahead and prepared for that to make sure you guys don't get spread too thin?
That's right. So, in Calhoun County, we have faced a number of threats during this time, mainly, starting back in January and February and on into March and then into April, tornado season, and that threat of severe weather. Thankfully, we didn't have any direct impacts from tornadoes in Calhoun County, but we did have 2 significant wind events that really caused a lot of damage throughout the county, and we did respond to those. But the way that we've been able to do that locally is the support of our elected officials, but also the buy-in and the participation of the first responders throughout all of Calhoun County in our unified command. We established a unified command as a follow-up to our task force very early on. And so that really expands out then the capacity of what we're able to do. The emergency management agencies continue to lead that effort, but without the participation of our first responder chiefs throughout the departments throughout the county, as well as making their other personnel available to plug into these critical positions, we wouldn't have been able to do it. No way we could have done it as effectively as we've had, but we've got a great team here in Calhoun County, and everybody has done their part. They've pitched in, and it's been one. There's been no this agency or that agency. We have been one. We have been the first responders of Calhoun County, and through the Unified Command, it's provided a great structure to be able to respond to whatever those needs are. As you well mentioned, the threat of natural disasters has not ceased. The threat of crime does not stop. The threat of fires and other medical emergencies don't stop. So collectively as a community, we've continued to have to make sure that we've got procedures and personnel in place to respond to that. We've done that. We've been able to successfully overcome that. And as we look ahead to the future, it's a good model, I think, that we can follow, for this county moving forward. as well as maybe a model and some best practices for some other counties. We've had other counties throughout the state of Alabama to reach out to us. They've heard about some of the best practices that we've had in Calhoun County. And thankfully, I think we've been able to help some of them put some things in place that, will benefit the people of those counties and the citizens of the state of Alabama as well.
I know I'm kind of jumping back and forth a little bit, but just kind of stream of consciousness as things come to mind. We don't have a whole lot longer, but let's talk about COVID-19 testing. You guys have been involved in a lot of the testing clinics and the mobile clinics where some of the testing has been done. What can you tell us about the future plan for testing, or maybe even just antibody testing to find out who's been exposed and who hasn't? What are we looking at locally as far as testing goes?
So locally, we've had a very robust testing capacity, thanks to RMC Hospital. They really came on early in the process with their drive-through testing, making that accessible to folks. Later in the process, the Alabama Department of Public Health has been able to support that effort through some test kits and through the access to their laboratory a little bit. And so testing will continue. We're well ahead of the state percentage of testing, and we have been for many weeks here in Calhoun County. So there's been great access to that, great participation, and then we have been able to deploy those community-based test sites that have gone strictly to communities. We've been able to roll out the same testing you can get in the hospital or you can get at the health department in the local community. So it provides better access for people who may have difficulty traveling to a certain area, and just makes it more convenient. So all these methods will continue moving forward. The hospital plans to continue their drive-through testing for several more weeks now, and they will evaluate that based on the need in the community. The health department, they have started doing testings every Monday and Wednesday in the morning time. And so that's good. That provides good access. But our community-based testing will continue as well. Over the next several weeks, we plan to continue to have that in the various communities throughout Calhoun County, at least one a week for the next 3 or 4 weeks. And again, we'll reevaluate that. It's constantly being monitored based on the demand in the community. We'll continue to work with the partners in both public health as well as the hospital to provide those resources as needed. So if somebody needs tested in Calhoun County, they should be able to be tested. Every testing site that we've done, there have been test kits left over. We've had good participation, but we've not seen a shortage of test kits in more recent weeks. So I'd encourage people, because of that number we talked about earlier, that it looks like there's 10% of people that may be asymptomatic positive out there walking around. That if you have any idea or you feel anything different about your body that you feel like you may need to get checked out, go be tested.
And it's important to not just show up at your doctor's office and ask about testing. What's the procedure for getting tested? If other than you hear about a walk-up testing site or things like that, but again, tell us a little bit about the best practices for testing. If you're not feeling well and you think you need to be tested, and again, we don't want you just showing up at your doctor's office. What are you supposed to do? What's the process there?
So the first thing we do, if it's not life-threatening right then, is to call your primary physician. Call them and say, hey, I'm experiencing these type of symptoms or something doesn't feel right. Talk to your doctor about that. And then they'll tell you, well, hey, we think you need to be tested. A lot of the local doctor's offices are able to conduct testing now. And so most primary physicians can do that. So they may have instructions for a person on, hey, come to the office. When you get here, call in. Tell us you're here, and then they'll walk you through the process there. Or they may say, hey, we're going to call you in an order to be tested at the RMC drive-through clinic. And they'll talk you through what that process is there. If you hear about a test site that's available in the community and you want to show up to that, that's great. But when you get there, follow instructions and follow the signs. Stay in your vehicle. There'll be signs, there'll be people along the way that provide direction on how you can be tested to protect yourself, but to also protect those medical professionals that are there to help you be tested.
Sounds good. Before we go, Michael, anything we've left out, anything you'd like to add to our discussion today?
So I would encourage folks to make sure they check out the wealth of information that we have on our website at calhounema.org. There's a lot of information there in many different places. There is a specific COVID-19 tab there you can click that'll take you to a page that talks about many of the things that we've discussed here today. It's a place that has the latest updates on what's happening across the county, but also the orders from the governor and what the public health orders currently are. It also has the safe reopening tab that we talked about, a lot of those best practices that people can take for their households or for their organizations and put those into play. And it also has vital contact information. So calhounema.org. We're also out there on the social media platforms of Facebook, Twitter, and Instagram. So look for us there. It's another good way to stay up to date with the latest information. If folks need assistance, they can call the resource hotline at 211, and they can be connected there with a call resource specialist that'll help connect local people with local resources. And as always, folks can call the Emergency Management Agency at 256-435-0540, and we'll be glad to help in any way that we can.
And one more quick thing, Everbridge. You guys have a new notification system. You're moving away from Nixle and some of the other notification systems, and you've brought in Everbridge. Tell us just real quickly how to get connected with Everbridge.
That's right. So Everbridge is a mass notification system. It's customizable to the person. So if you want to receive emergency notifications by text message, you can sign up for those. If you want to receive a phone call, you can sign up for that. If you want it sent to your email, you can subscribe that way. So we can affect many people in many different ways. So the best way to do that is to go to our website at calhounema.org. At the very top of the website, there's a red box that says sign up for emergency alerts. Click on that button and it'll take you directly to the Everbridge page to be able to subscribe to your unique preferences.
Wonderful. Thank you very much, Michael. I want to say a big thank you to you and your entire staff and all of the folks who are working tirelessly to keep us safe, not just in COVID-19, but through all of the potential disasters and emergency situations that could come up in our community. You guys are doing a great job, and we do appreciate the work you're doing.
Well, yes, sir. Thank you, Carl. That's what we're here for, is to serve the community, and we're glad to be able to do that. We appreciate you and East Alabama Works and the work that y'all do and the support that you've offered as well. And we appreciate the time today.
Thank you very much. And folks, thank you for joining us for our East Alabama Works video podcast. Remember our website if you should need any information about business and industry, job seekers, education and job training, those kind of things. You can find all of that at eastalabamaworks.com. Thank you for joining us today.